Now, what role does mouthwash play in better plaque control? Well, let's take a look at the data. Now, better plaque control, it means not just using the mouthwash products, but also using mechanical agents with them. Here we see devices to help the patients clean in those areas between the teeth, which we know are difficult for many of our patients. Proxabrushes are of value if we have adequate diastema. Proxabrushes are of high value around implants. And then we have the soft picks, which are of value around implants and also around teeth. Now, what these products do is they disrupt, just like a toothbrush, they help disrupt the biofilm in the teeth, increasing the access to the biofilm by the chemical agents we are using. Now, this point is important because we have to make our patients understand that if they just do brushing and mechanical methods, they're going to miss some areas. But we have to use those methods, but if we add chemical agents to them, they enhance the mechanical methods that the patients are using. Now here's using the Proxabrush, and we're using it around implants. And by doing this, we end up with implant surfaces, which, as you can see here, are very, very clean. And this patient's been doing this for a week now. Tissue is very healthy. And this is how we like our implant patients to look, with these very, very clean surfaces and this very healthy looking gingiva. Now, here's an point I'd like to make. If you look at the Proxabrush, the bristles are attached to the core. Where this attachment occurs, if the patient has used toothpaste on this brush to clean around these implants prior to using the mouth rinse, then here's what could happen. The products, as you know, the products of toothpaste, they dry up on these brushes and they stick to the contact point where the brush meets the bristle meets the core of the brush. Now, I'm making this point because there is a drug interaction between toothpaste ingredients and chlorhexidine, which decreases the activity of chlorhexidine. So therefore, it's a very simple message. If we're going to use these brushes to deliver a toothpaste and also to deliver a mouth rinse, and we're using chlorhexidine, which is the most effective mouth rinse, using chlorhexidine as our mouth rinse for our patient, we'd like them to use brushes dedicated to toothpaste and then a separate brush dedicated to the mouth rinse so that the ingredients in the brush don't mix with those in the mouth rinse and decrease the activity due to that drug interaction. And by the way, a similar drug interaction occurs between stannous fluoride products and chlorhexidine. And so we'd like to also minimize that with the same procedure, separate brushes for the toothpaste with stannous fluoride in it, and separate brush for the mouth rinse containing chlorhexidine. And here's the two interactions I'd like you to remember listed for you. Number one, the activity of chlorhexidine is decreased by dentifrice ingredients. And number two, the activity is also decreased by stannous fluoride.